Problems and complications related to PD and initial management.
Hello, we are back again from the previous chapters. You have learned and understood more about kidney disease.
In the last chapter, we explained some basic knowledge about peritoneal dialysis, PD. This time, we're going to add a little bit more knowledge about problems and complications related to PD and the initial management.
The patients may face certain problems associated with their dialysis regime.
Now let's watch a cartoon animation.
The following problems and complications may occur while performing PD. 1. Peritonitis. Symptoms include cloudy dialysate bag with or without fibrin, fever with a temperature higher than 37.5 degrees Celsius, abdominal pain, nausea, vomiting, or diarrhea that is not the result of food poisoning, or inadequate fluid removal from the bag exchanges. These are caused by an invasion of external pathogens into the patient's abdominal cavity.
That sounds scary! What are the pathogens?
Pathogens are small organisms that we cannot see with our naked eyes. They normally inhabit the skin, nasal cavity, tips and sides of your fingernails, hands, equipment, and the environment. When they invade the abdominal cavity, they cause inflammation. This is called an infection. If an infection is severe, the peritoneal cavity could be damaged and the patient's life could be threatened.
And how can these pathogens invade the peritoneal cavity?
Pathogens may invade the cavity when the intestinal wall is weak, for example, while having diarrhea or constipation, or accidental contamination during wound cleaning, hand washing, or the PD bag exchanging as follows. 1. Incorrect, inadequate, or no hand washing.
2. Incorrectly performing a bag exchange, accidentally or carelessly allowing the transfer tube or catheter connector to be contaminated.
3. If the rooms used to perform the bag exchange or storage of the PD cartons and other equipment is damp, dirty, or dusty.
4. Using poor quality, expired, or leaking PD bags.
5. An infection of the exit site where the catheter leaves the peritoneal cavity.
6. Eating food that is unhygienic, spoiled, not properly cooked, or swarmed by flies, or if a patient has a chronic diarrhea or constipation.
If you have peritonitis, you must report to the clinic and bring the first cloudy bag with you. Do not delay, otherwise your take-off catheter may be removed, causing more trouble.
Yes, as for a peritonitis treatment, a patient will be given an antibiotic for 14 or 21 days, depending on the type of pathogen.
Your doctor may add an antibiotic into the PD bag or give it intravenously depending on the severity of the infection. Importantly, during the treatment, a patient must bring the PD fluid for a cell count at every appointment and follow any instruction given.
Yes, we can prevent peritonitis. However, if a patient is infected, it is an emergency and the patient must see a doctor.
Yes, because peritonitis can cause peritoneal damage, resulting in losing its ability to remove excess water from the body, intestinal obstructions, and intra-abdominal abscess, leading to shock and, in some cases, death.
And another important thing to remember is not to leave the bag with the antibiotic in the car, parked outside on a sunny day. This is because the heat from the sunlight will impair the antibiotic's efficacy in killing bacteria and cause the treatment to fail.
2. An exit site infection. Symptoms of exit site infection include redness, oozing, aching, or wound tenderness.
Report to your doctor straight away before the pathogens further invade the peritoneal cavity.
Causes of the exit site infection are 1. Inadequate, improper, or no hand washing before performing routine exit site care.
2. Scratching the exit, removing the crust, or the exit is compressed for a long time.
3. The catheter has been pulled, twisted, or not properly immobilized.
4. Not following or skipping the dressing steps or leaving the exit damp or wet.
5. Bathing or swimming in natural water sources or not cleaning the wound immediately after shower or swimming.
For treatment of an exit site infection, you need to increase the frequency of exit site care.
Do not remove scabs or crust on the wound.
Applying a topical antibiotic and taking an antibiotic prescribed by your doctor.
You should stabilize the catheter properly and avoid tugging and twisting. Do not have a shower while the wound is infected. Clean your body by using a sponge instead, or only shower part by part.
The treatment will be successful if the patient strictly follows the advice given by the doctor. 3. In case the PD tube leaks, becomes disconnected or contaminated, you will have to follow the following steps immediately. 1. Stop the PD. 2. Drain the PD fluid from the peritoneal cavity as much as possible. Beware of any reflux of the contaminated PD fluid into the peritoneal cavity. 3. Clamp the PD tube proximal to the leakage or contaminated point. You can do this with either a clip or by folding the tube and securing it with a rubber band. This will prevent any reflux of contaminated PD fluid into the abdominal cavity. 4. Soak some gauze with povidone and wrap it around the leakage or contaminated point and go to the PD clinic straight away. Bring a spare transfer tube to perform a line change.
4. If the PD fluid is not running into the peritoneal cavity after the clamp has been released,
first, you will have to check if there is a catheter kink or blockage. Lift the bag high up or squeeze it to increase the flow rate. And turn the patient side to side or ask him to walk around. If you have tried everything and it's still not working, you will have to see a doctor straight away. Do not try to solve the problem by yourself.
And 5. If there is a significant loss of the daily net ultrafiltration, or if the volume removed from the bag exchange is unusually low. Together with swollen legs, arms, eyelids, or any unusual weight gain, you must report to your doctor immediately. If symptoms are severe, the patient may experience breathing difficulties when lying down.
You have to reduce your fluid intake and restrict the amount of food taken. Refrain from eating salty foods and reduce the amount of sodium salt consumed to less than 2 grams per day. Increase the glucose strength of the PD bag and tell your doctor straight away, as the continuous use of strong bags may cause permanent damage to the peritoneum, making PD an ineffective mode of dialysis.
This is because the kidney of a patient with chronic kidney disease is unable to adjust the amount of urine excreted according to the amount of fluid intake. Therefore, you will need to pay close attention to the amount of fluid intake and salty food consumed.
An adult patient should drink approximately 500 ml of water, plus the amount of ultrafiltration and urine excreted each day. Please keep in mind that you should take into account the fluid content from food as well. This includes soups, curries, juices, and other drinks. It would be best to have your carry-on water bottle with measurement levels.
6. Causes of fluid overload are if the patient has taken more fluid than they have excreted from the body, or if the patient has salty food, which will increase their body weight. This may also cause your eyelids, the back of the hands and feet to swell, fatigue, breathing difficulties, or high blood pressure. You can notice early signs of fluid overload if there is a weight gain of more than 0.5 kg per week or 2 kg per month. If this happens, you should restrict your fluid intake and salty food consumed, as well as increasing the concentration of glucose in the PD bag.
You can monitor your fluid balance by weighing yourself and recording your blood pressure every day.
However, dehydration may be caused by having too little fluid intake than fluid excreted from the body. A patient may also have dry skin, feel dizzy, and low blood pressure. If you have any of these symptoms, please notify your doctor straight away. Do not try to solve the problem by yourself.
Most PD patients will also be prescribed several oral and injectable medications as follows. 1. EPO or red blood cell stimulating drug. 2. Antihypertensive drugs. 3. Acid-reducing agents. 4. Phosphate chelating agents including calcium tablets, sevelamer, and lanthanum. 5. Iron and vitamin supplements. 6. Antiplatelet drug. And 7. Other medications such as anti-diabetic and lipid-lowering drugs, etc. You should remember the name, strength, dose, and any precautions for or adverse reactions from the medications you are taking.
If you suspect any adverse reactions from your medications, please inform your doctor, pharmacist, or nurse straight away so that the problem can be resolved properly before you develop serious side effects.
Do not take any vitamins or food supplements without consulting your doctor, as they may interact with medications that you are taking. The supplements can also accumulate in your body, which may be harmful.
If you can't take medication at the dose prescribed, please inform your doctor or nurse so that the treatment can be adjusted for you.
If there is an unusual reaction with a new prescribed medication, please remember the name and the reaction and inform your doctor or nurse so that your doctor won't prescribe the same medication again.
If you have any concerns regarding your medication, you can always ask your doctor, pharmacist, or nurse.
Oral hygiene is also important. Teeth help us to chew food and support our face contour. If we don't take good care of our teeth, we may suffer from tooth decay or gum disease. This can be a source of peritonitis.
You have to keep your mouth clean by brushing your teeth at least twice a day, morning and night, using a correct technique. In addition, you have to use dental floss at least once a day before going to bed, as the brush cannot reach all the spaces between the teeth. You should also avoid sugary food, sweets, soft drinks, smoking, and drinking alcohol.
And don't forget to see your dentist twice a year.
You should also inform your dentist that you have kidney disease and are receiving PD so that your dentist can plan your treatment carefully.
For an effective treatment, you should not miss any appointments with your doctor.
That's right, you should also prepare yourself before the appointment as follows. Make a reminder note 2 or 3 days before the appointment date, so you will have enough time to prepare yourself.
Sometimes you will be required to collect a 24-hour urine sample. However, if you pass urine only once a day or less, there is no need to.
Please also bring your PD record book.
In case you record your blood sugar level, blood pressure, and weight in a separate record keeping, please bring these records with you as well.
Keep a diet record diary for 3 days of the week, which should include 2 weekdays and 1 day from the weekend.
Write down any questions you may have to ask your doctor.
Refrain from food and drinks as stated in your appointment notes. On your appointment day, please don't forget to bring your PD record book, stock take list, and your 3-day diet history.
Bring your 24-hour urine sample in spent dialysate bags for the test as stated in your appointment notes.
You should refrain from food and drink from 10 p.m. the night before until the appointment time of your blood test the next day, so that your blood sugar and lipid levels can be measured. You should also bring some food and medications with you to the hospital.
Please don't forget our suggestions, as these will improve treatment outcome.
Nevertheless, hemodialysis and peritoneal dialysis are only a kidney replacement therapy and will not cure kidney disease. The patient will have to receive dialysis for the rest of their life or until he has received a kidney transplant. Our human body is like a car. You have to take good care of yourself with regular maintenance. If a part is broken, you will have to get it fixed, but don't wait until it's unable to do so.
Thus, you should plan for a kidney transplant. Take good care of your mind and body. Take in only what is good for your health so that both your mind and body are healthy and strong.
Yes, we are always here for you. Goodbye.
Goodbye.